When you look at, us as a country, from the church to the family to the government to our learning institutions to the legal provisions that we have put in place to deal with these issues, how comes we are getting it wrong?
Thank you for your question. I think we got it wrong from the word go when we started saying, using the phrase, the war on drugs. When you militarize a public health problem instead of creating a response, it becomes a problem. And the reason why drug use is growing is because of industrialization. There is more money, people having more jobs. Africa is having a huge population of young people, and these people are stressed. Just getting on social media and having 2 phones is stressful for a teenager. And psychologically, a teenager goes through more stress than an older person. And because, just the way Maurice says, a lot of us are doing passive parenting. Parents are very busy looking for money. I want to go to work, at the same time I want to go to class. So at what point am I going to take care of my child? I leave my child to TV. And then children are on social media. Peer influence now is more broader than it was when we were growing up. Why? Because when I was growing up in Siaya, my peers were probably people in my village. But now my child has peers on social media from Canada, from the US. So if we are talking about peer influence, the young people now are going through more stress and more peers. So psychologically, people want to deal with their stresses differently. I may want to go and pray. Another person will want to take marijuana. Another person will want to smoke tobacco. So we deal with our stresses differently. And because of this peer influence, again, young people get into drug use. So you realize there are so many factors that are coming in, but the government is not doing enough. Why? Because we are saying it's a war. When you militarize a problem, a social problem, that's the issue now. People go into hiding. When they hide now, they start injecting. Then parents, we don't want to talk about drug use. Why? Because we think it's a security issue. It is not a security issue. It's a public health problem that we should deal with. And that is why the prevalence of HIV for people who inject drugs has been high for the last 10 years and is not going down, because we are not talking about the problem. So we got it wrong from